name is Mary May Jorgeo, and I am a medical student at Southwestern University, FINMA, and I will be assessing your abdomen. So is it okay, ma'am?
Yes.
Okay. So by the way, can you please state your full name and your date of birth?
I'm Sheldon M. Jorgeo and I'm born on October 23, 2001.
Okay. So is it okay, ma'am, if we will have a video taken for documentation purposes only?
Sure.
Okay. So can you please sign this, ma'am? Thank you so much. Now that our patient is lying in supine position, the first thing we will do is we will inspect the abdomen, the color, if there is any bruises, erythema, or even jaundice. The next thing is we will also take note of scars of previous surgery, and if there is any, then we should locate or diagram their location. And the next thing is we will also inspect if there is any enlarged or dilated veins. And the last thing is if there is any rashes or ecchymosis. So for our patient, there is no presence of jaundice, no rashes also, and no enlarged or dilated veins. So the next thing is we will proceed with auscultation. So we do our auscultation first before the percussion and palpation for us not to alter the bowel sound. So we will now auscultate for bruits and friction rub. So we will auscultate the bruits on the aorta, the renal artery, and the iliac artery. So if there is any presence of bruits, then it could indicate that there is a turbulent blood flow on those arteries. So next is we will also auscultate for the friction rub on the liver and the spleen. So if there is any presence of friction rub, then it could indicate that there is a gonococcal infection or liver hepatoma. So there is no presence of bruise and friction rubs. So now we are also going to auscultate for the bowel sounds, noting their character and their frequency. So our normal bowel sounds is 5 to 34 per minute. And if there is any alteration in the bowel sounds, that it can indicate that the patient has diarrhea. And if there is hypoactive bowel sounds, then it could be there is an intestinal obstruction. So normally we should auscultate it for 1 full minute in each quadrant. So right after our auscultation, that we will proceed with percussion of all quadrants of our abdomen. So we do percussion to know if there is any dullness, because if there is any presence of dullness in our abdomen, that it could indicate that there is an enlarged mass. So our patient has tympanic sound, so meaning this it is normal. Now we are going to proceed with our light and deep palpation. This is for us to assess for any tenderness if there is any enlarged mass. So ma'am, stir if there is pain, ha? If I will palpate. So this is light palpation. We will also do deep palpation using 2 hands. Nakay mag-feel ng pain, ma'am? Okay raw, wala rin sakit. Okay. So now we are going to proceed in the liver. So we will percuss liver span. And if there is increased dullness on the percussion, then it could indicate that there is a liver disease. after our liver span measurement, then we will proceed with palpating the liver edge. So if there is a firmness, then it could be possible uh, of a liver disease. So there is also another technique for palpation. It is called hooking technique. So this is indicated for especially if the patient is obese. So now we are going to palpate or percuss the bladder. So normally the bladder is not really palpable unless it is distended in the symphysis pubis. So if there is a tenderness in the bladder, then it could indicate a possible bladder infection. So right after bladder palpation and percussion, then we will proceed with palpating the right and left kidney. So now we are palpating the right kidney. So there is no mass and tenderness upon palpation. So after, we will proceed with percussion of the right and left kidney. So ma'am, pwede mo storyata if na-ay pain, if ako i-percuss imuhang kuan ha. So pwede ta mo takili. Okay. So we will first percuss on her right kidney. So we will use our fist of the hand. So ma'am, tell me if na-ay pain, ma'am ha. Na-ay pain? Okay, so sa pikas ta ma'am. Na-ay pain?
No.
Okay, so thank you. So right after, so there is no pain, we should also assess if there is any appendicitis. So first, we will test for the rousing site. So we will put pressure or palpate the left lower quadrant, and if the patient felt the pain on the right lower quadrant, then it could indicate a possible appendicitis. So, ma'am, ako na siya i-palpate and tell me if there is a radiating pain on your right lower quadrant, okay? So, is there any pain? Okay, so there is no pain or there is no radiating pain to the right lower quadrant. So there is negative for rousing sign. So next is we will test for the SOA sign. So we will put pressure on the right thigh of the patient, and the patient will try to lift against my hand. Sige, pwede na. Okay. So can you feel any pain on your abdomen, ma'am? No? So if there is a positive psoas sign, then it could indicate that there is an irritation in the psoas muscle in the abdomen. So it is possible for acute appendicitis. So the patient felt no pain, so therefore there is no appendicitis. So we will also assess for Morphy's sign to know if there is an acute cholecystitis. So we will palpate or put pressure on the gallbladder or in the liver part of the patient. So let the patient inhale and exhale deeply, and if he or she can feel pain, and if we can also felt tenderness, then it can indicate that it is positive for Morphy's sign. Therefore, it is positive for acute cholecystitis. So, ma'am, ginhawa na ta og lalom, then tell me if you can feel pain upon inspiration. So we didn't, the patient, wala pain. So the patient felt no pain, and we also didn't feel any tenderness. So therefore, the patient is negative of acute cholecystitis. So overall, our patient is normal, and there is no alteration in the bowel sounds, and everything is normal on her abdomen. So thank you, ma'am, for your patience and for your time.